Australians are, of course, counting down now to the new range of major restrictions on our lives, social lives, corporate, business and hospitality. Stage 2 phase from midnight. Food courts will be allowed only for takeaway. Health clubs closed, amusement parks, beauticians, tanning salons, spas, massage centres, all of these will be closed as of this evening. Outdoor activity will exercise. Participants of 10 or less will be allowed. Things like boot camps. There are strict protocols around weddings. Only 5 guests allowed, as well, of course, as the witnesses. Funerals will be restricted to only 10 people. And despite these restrictions only being announced last night, in Victoria, Premier Andrews is already warning of stage 3 shutdowns. We'll bring you more on that in a moment. For now, though, let's take you through the latest numbers around the country. 116 new cases in New South Wales. That state passes the 1,000 mark. 466 in Victoria, an overnight increase of 55. A similar increase in Queensland, where borders will be closed from tonight. 46 more cases. There are 170 cases in South Australia. In WA, 205. That's 30 more over the last 24 hours. The ACT, 44. Northern Territory, 5. And Tasmania, 36 cases. And nationwide, nearly 2,400. Victoria has flagged moving to a stage 3 lockdown, as I mentioned, ahead of other states and territories as it battles to stop that spread of COVID-19. Prime Minister Morrison has defended the states taking different approaches, explaining the problems are more urgent in some than others.
Even before stage 2 restrictions were implemented in Victoria, the Premier was already talking about moving to a stage 3 lockdown.
There will be a stage 3. Now that's not to be announced today, that's not yet determined, but it is coming.
Exactly what that will entail or when the trigger will be pulled is unknown, only that New South Wales and Victoria will be the first to move. The discrepancies across state borders today explained by the Prime Minister, Scott Morrison, saying while he would prefer the country to move as one, different states will need to act with different speeds.
I can assure everyone that no measure has been restrained from in any state or territory. If any state or territory felt they needed to take those more urgent actions, then I know they would do it through the National Cabinet.
Among the latest confirmed cases in Victoria, 4 healthcare workers at the Werribee Mercy Hospital Emergency Department. The ED has since been cleaned and reopened, with close contacts placed in quarantine. A new live data stream of COVID-19 in Victoria paints a grim picture of a steep curve, as did confirmation the state's second coronavirus ICU patient is only in their 30s.
COVID-19 is not an elderly person's disease.
We've got queues at Centrelink offices. That's heartbreaking. What we don't want is queues for people who need a machine to help them breathe. We cannot have people queuing for intensive care beds. That will mean they will die.
The Vic Emergency app is already being utilised to push out the latest health alerts to all Victorians. Now the state government is working to repurpose its text alert system, used most recently during the Gippsland bushfires, to do the same. Patrick Murrell, Sky News, Melbourne.